Good morning, everyone. Aster CMI is live today. Today we are here to discuss about a common concern that an individual is having during the COVID-19 pandemic, that is a healthy BMI. And I am Dr. Vanita, DNB Resident General Surgery. I have here with me Dr. Mahesh Chikkachannappa, Senior Consultant, General Laparoscopic and Bariatric Surgery. Who will help us to get an awareness about how to maintain a healthy BMI. Good morning, sir.
Yeah. Good morning, Vanita.
And could you brief us about how obesity can affect one's coronavirus infection risk and how to stay safe, sir?
Good morning. Good morning, everyone. Today we are here to discuss about the risks of coronavirus affecting the obese patients. And throughout the world, various statistics says that there is a big implication of coronavirus infection to the obese individuals, and we are here to discuss about that. Definitely, the world statistics says that at least roughly 67% of the patients affected in the Europe and America by the coronavirus, both mortality and morbidity is obese individuals. So we need to gear up and take some precautions and control our weight so that this pandemic should not be affecting more the obese individual or the overweight individual.
Yeah. Thank you, sir. Sir, I have few questions from our viewers.
Yeah.
First one is how obese people are more prone to COVID-19?
Yeah. Patients who are overweight or obese, they are prone for many comorbidities, like it could be diabetes or blood pressure or heart diseases, lung issues. So this coronavirus predominantly is affecting the lungs. So these patients will have a decreased lung volume, and there is a big pressure on the lungs. So compared to a normal individual, the coping up capacity with the affection of the lung by the coronavirus can be reduced in obese individuals, and they may have predominant signs and symptoms, and some of them where the viral load of the disease is gone beyond range, so they can also succumb because of the overweight.
Yes, sir. And second question, how can I manage my BMI during this lockdown?
Yeah, it's an important question. Not only like obese individuals, it is a good question for people who are moderately, who are almost ideal weight also, because since last 4 to 5 weeks, we are all locked down and not having much of activities except the frontline warriors. Most of us, are at home, and this is something new for all of us. So we need to adjust our lifestyle so that we don't put on weight. And for that, it's better to start from the beginning of the day to have a discipline in our lifestyle, get up at proper time, and eat healthy, then at the same time have certain activities, and also increase the amount of time, like you're active, because whatever we eat should get burnt, or at least some of them should convert into calories and should be utilized. But if you don't move, if you don't work at all, then it becomes difficult. On an average, even if you're not doing exercises, a person who is coming to his office, traveling and going back home, by doing this work, he tends to burn out some 200 to 50 calories. So that will also accumulate. So it's very, very prime to make sure, you do some exercises. At the same time, make sure you do quality exercises, which will help you in burning those calories, is very important. At the same time, diet is also very important, to eat healthy, because a lot of food is available in the right season, and though there is lockdown, I have seen there is plenty of food available to people, and as always, eating is a favorite pastime for any community. And since you're all together at home, we may actually start preparing a lot of fried food, a lot of snacks. So I think you should cut down on those things, and all of them in the family should think about, preparing healthy food, eating a little lesser than what they normally eat. That is also important. And the right food, even if they want to snack, they can snack on salads, they can snack on some good fruits, which would provide only less calories. And they are healthy also, rich in vitamins and minerals, and which would also help to fight this disease. Not only coronavirus, but for that matter, any other, flu, it could be any other diseases. So I would recommend eating a little lesser than what you eat, healthy food, and definitely double the physical activities. Is very important.
So how my weight can affect the risk of coronavirus?
Yeah, as I earlier mentioned, throughout the world, coronavirus has affected obese individuals. And the reason what I have told you, because their immunity comes down with the obesity. The body can't cope up with any other infection for that matter. So suppose anybody is obese, they have comorbidities. So they're already compromised with respect to, could be lung problems, with respect to decreased pulmonary functions, because there is always the pressure of the excess weight in the tummy, putting pressure on the lungs. They may be smokers, and they may be on various medications which could have reduced their coping up capacity with any sort of viral disease. And this corona particularly is affecting the lungs predominantly. So obese individuals, because of the reduced capacity of the lung, they will have symptoms and problems. So this is how overweight can be affected by coronavirus.
Yes.
Yeah.
And is taking calcium supplements reduces the risk of coronavirus?
Okay. Yeah, various information is available in the media and newspaper. Daily we see a lot of things coming up. There is a lot of alternative medicines they claim to help, to fight this disease. So far, there is no any proven benefits by any particular substance as such. But yes, generally, as I mentioned earlier, if you eat healthy food, consume food rich in vitamins and minerals, eat fruits and vegetables which have anti-inflammatory properties like almonds, like mango, which is seasonally available. They all have good vitamins, rich in all minerals. So I think it is, other than pointing out on one particular mineral, generally a good diet, keeping yourself fit, and to have a positive morale is very, very important at this time.
Yes. And can you please suggest some good exercise that can be performed while working from home?
Working from home is not a new thing.
Yes.
With this, been there since many years, where we started, working globally. So at least 20 to 30% of the population in the country, they work from home. It's not a new thing. So most of them have modified their lifestyle, depending on that. Yes, coming to the time lockdown, wherein all your family members are at home, you need to think, differently and make sure, you first thing is to eat less. Then another thing is exercises. So coming to what exercises, you can do at home. Yes, if you have stairs at home, make it a habit to have a count on, the time or the count of the stairs, and that is a very good exercises. It will improve your lung capacity, it will improve your muscles in the legs. Also, do good breathing exercise during that time, so it will improve your lungs also. If you have a huge compound around your house, you can walk around in the compound. If you have a garden, get involved actively, plant new, seeds, do some gardening, sit, bend, get up, lift small things, keep doing those work morning and evening. Then various, apps are available, and in fact, they've been generous to give you, free advice during this COVID lockdown time. So get help from that, and you can do yoga, you can do power yoga, where you spend less time but burn more calories. So these are the things which will help you. At the same time, use your own body weight and try to do some exercises, and walking within your compound, as I mentioned earlier. These things will all help. And the hospitals are open for advice. We have teleconsultation in our hospital. You can speak to our physiotherapists, who can recommend you some exercises based on your limitations. And also we have dietitians who are available over the teleconsultation. Since last 10-15 days, the hospital has made this facility available to all our patients, so you can make use of it not only for exercise and diet. You can other problems if you have, you can discuss with your doctors and take help.
Yes. And how can I protect myself and prevent infection?
Yeah, this is holds good for any individual, not only obese patients, as the government and as the media, as the your area, could be police or the frontline warriors are suggesting. Make sure maintain social distance, then hand washing very important, and wear mask. Since the lockdown is easing a bit now, make sure especially obese individuals are at more risk. Make sure you wear a mask always, a good quality mask always. Avoid going out unnecessarily, for some more time. Then, if there is any symptoms you feel that you are worrying, better to call your doctor or visit the hospital, meet the doctors in the flu clinic and get it clarified.
Yes. And what are the health consequences of obesity in childhood during this COVID-19 pandemic? In childhood obesity.
Childhood obesity. Fortunately, coronavirus has not affected children. If you see the world statistics, the very, very strange incidents where children below 12 or 14 has been affected. But yes, somebody who is obese, they should be careful, and so they should follow the norms what I just mentioned. Like social distancing, avoid visiting the friends' houses, or even unnecessary eating junk food at home. They also should be encouraged to do active work at home, do some exercise within the house. These things will help them to prevent having coronavirus disease. But yes, children have been fortunate. We have very, very, very strange incidents where coronavirus affected the children.
And what medications are used to treat obesity?
Obesity per se is a lifestyle disease. Very, very few statistics to say it is only genetics. So it is a lifestyle disease. Lifestyle modification is very important. Exercise and diet. There have been various medicines which came in the market, but there is no any specific medicine which will help you in decreasing the weight. People have tried various medications, anti-diabetics, all those things, but they're all momentary and they come with the side effects. So far, for obesity, a BMI more than 32 or 35, if some individual have tried exercise, diet, and they are not able to reduce the weight, bariatric surgery is the one proven tool to prevent obesity or to help someone who can shed the weight. But we have a structured program in our hospital wherein we evaluate them to see whether they can reduce weight by diet, exercise, and see what is the reason for obesity. And then we advise, yes, medicines are less helpful. Surgery is the best answer if someone is keen, and if they have tried and failed to reduce weight.
And you did get any queries, sir, during this lockdown period in regard of obesity and coronavirus infection?
Surprisingly, there's an irony where some of the patients who were obese, they were actually, worried that they're obese and what if they might caught up the coronavirus. And they did, call me asking for, could they get the surgery done now so that, they will be prevented from having this coronavirus disease. Yes, they can come down and we'll talk to them, we'll evaluate, and we'll make sure, they are evaluated thoroughly and we see the cause of obesity. And yes, if they have tried everything and once things settle down, we can definitely help them by doing bariatric surgery.
And what suggestion you will give to our viewers, sir, to cope up with obesity and COVID infection?
Yeah. Okay, as I said earlier, it's better to stay safe, still continue, maintain the social distance, listen to your government and authorities, maintain distance, wear a mask always, wherever you go, wash your hands thoroughly, avoid touching your face, unnecessarily. Unnecessarily, don't go out if it is not important, if it is not necessary. Continue maintaining the social distance and help the frontline warriors who are helping you since last 2 months to continue helping you so that the community remains safe and we kill this deadly disease and come out winners.
And we have some queries from our viewers, sir. We'll just read out that one.
Yeah, fine.
And please suggest me few exercises, sir.
Yeah, I think already I have
discussed.
mentioned and we have discussed about this. So first thing is, yes, if you have stairs at home, you can climb it up and down and have a count or have a time, and you can improve that day by day so that you become efficient and do regular breathing exercises. And the other exercises is like isometric body contraction exercises. Use your own body weight and do some exercises. Your physiotherapist, or there are a lot of online apps, they could help you. And definitely diet, very important. Make sure you eat healthy diet that will bring down your excess weight at least by 20% if you maintain a good healthy diet.
Yes, sir. One more query is, how fatal is this infection for people with overweight, sir?
Yeah, that's what we are discussing here. It is definitely very, very fatal. Throughout the world, the statistic suggests 67% of the deaths by coronavirus is to the obese individuals, especially in UK and US. So definitely compared to a person who is near normal weight and obese individual, the obese individual are at higher risk from this disease because they are already compromised with other diseases, because obesity comes with various comorbidities, definitely diabetes, hypertension, hypercholesterolemia, and heart diseases, and also lung problems. So definitely you should make sure to not put on weight during this lockdown, and if you are obese, put conscious effort to try to reduce weight.
And one more query is relationship between obesity and COVID-19 infection, sir. That we have discussed already, I think. And what percentage does the immunity play a part with regard to getting contracted with the virus?
There is no definite percentage where a proven percentage which says that if you are immune, you won't get coronavirus disease. But your overall homeostasis, that is your general health, your food habits, your lifestyle, not having smoking, not consuming alcohol, maintaining a healthy diet, maintaining a good weight, all these things help you in fighting this disease overall. And that's why some of them, they may be positive, but they have not shown any symptoms because their immunity levels may be good to fight this viral load, and they'll come out of it.
And one thing is, in obese people, lungs will be compromised mostly.
Yeah,
and coronavirus affects lungs mostly.
Correct. As I mentioned earlier, the pressure on the lungs is more, lung expansion decreases. They're already always compromised. They will have sleep apnea, things like that. So they are more prone for this infection and difficult for them to fight it. It affects the lung and the virus take the upper hand, and that causes the problem.
There are no more queries, I think, sir. Just wait for some time.
Okay, sure.
So that's a wrap, sir. Thank you, viewers, for being with us. And so we hope we have answered all the queries, sir. If not, you can drop the queries in the comment section and our experts will clarify your doubts. Thank you.
Thank you. Thank you, everyone. Stay safe, stay home.